But it's my pleasure to introduce our speakers for this breakout session. John Ahern and Gene Wade are with SHIP, the Senior Health Insurance Program, sponsored by RSVP, component of RSVP, and they will talk about, I know, Medicare and probably Medicaid, other governmental programs. And having recently signed up for Medicare, we were talking earlier, I don't think I've ever done anything more complicated in my life. And it's made a whole lot more complicated than it needs to be. And so any guidance, particularly deadlines, timeframes, things like that are very important to be aware of. Now, Molly McDougal is an oncology social worker with St. Mary's Hospital and Regional Medical Center. And I know deals with, specifically with cancer patients who have a lot of questions. And so she could probably touch base on a lot of other, or a broad range of topics for us. So without further ado, here you go.
Okay, first of all, you all have handouts in your bag. And it starts, it looks like this on the front page. That's our handout. So everybody got one, or we have some extras? Okay, great. Okay, so as Jim said, Medicare is very complex. But when you sit down and break it down into pieces and parts, it's not so bad. It's just that some parts have several names. So the government has been very good at making something that serves people basically 65 and over complicated, which didn't need to be quite so complicated. But we as SHIP volunteers are around to help make this a simpler thing for you. We do work out of RSVP. There are 7 of us here in Grand Junction. We are all volunteers. We don't sell anything, so we are as unbiased as we can be. We all have some biases we can't get over. But in the packet at the back is our phone number, and anytime you have questions on anything related to Medicare, we help you with that. So you can always call, and one of us will call you back and help you. What I wanted to do to start with is just go through the real basics of Medicare. Most of you, Molly's not on it, and you're not on it, but your parents are on Medicare, but just to help you understand which parts pay for certain things. So the first sheet we gave you is this one. And Medicare is for people who are 65 and over. Or if you have been on, and this is important if you know anyone else who is a cancer survivor, as some of you are, if someone goes on Social Security disability for 2 years, they then can go on Medicare at any age. So that's important for people to know. That's their insurance, that someone who's on disability can go on Medicare at any age. And we have people in their 20s who are on Medicare because they're on the government disability for at least 2 years. Now, there are a few, there are over 100 diseases which several cancers are on that list, that if you have one of those, unfortunately, because of the severity of them, you are approved for Social Security disability immediately. So if someone has certain kinds of cancers, they're on that list and they don't have to wait 2 years. Even get on disability sometimes takes a long time, it's a long process, but if you have one of those illnesses, you are on immediately and you can go right on to Medicare as well. So when we look at Medicare, there are 2 parts, A and B, and these are the parts of Medicare. A is basically hospitalization. B is basically your doctors and your testing, so the doctor services. So that's the 2 main parts you have, A and B. And on those 2 parts, Medicare pays 80%. So all the advertising you see, all the promotions, everything you see on television for all these companies is about how you might pay for all or part of the 20% Medicare doesn't cover and your drug coverage. So those are the way it breaks out in pieces and parts. What this chart says, and I'm not going to go through in depth, but if you have questions on any details about the different types of insurance, we're at the table and you also can call us. But once you know you're on Medicare and you got A and B, then there are several ways, different types of insurance you can purchase that will help you cover part or all of the 20% Medicare doesn't cover. So there are Medicare Advantage plans, and in town here, those are offered by Humana. There are cost plans, that's Rocky Mountain Health Plans, as you all know the name of that company. There are Medigap plans you can purchase, And then there are other things, like people who are retired from the state, they have paracare, and that can provide a supplement to help pay that 20%. There are VA benefits, TRICARE is a government retirement one, FEHB is another federal. Federal employees have a lot of different retirement plans. We don't understand them all, but we tell people if they have that, they have really good coverage, stick with it. It's very good. So, and then sometimes your employer will offer an insurance when you're retired and you go on Medicare. Some large companies still offer a supplement that helps pay part or all of the 20%. So there are a lot of several ways you can help pay that 20%. And that's where all the confusion comes in, because people say, which kind should I buy? Because there are, for instance, the Medigap plan, you pay a higher premium, but it pays most all your other expenses of that 20%. The cost plans and the Medicare Advantage plans, you pay lower premiums, sometimes as low as $0, but you pay a lot more out of your pocket as you go along. So those are just the options. I'm not going to go into them in great depth, but if anybody has any questions on those options to help pay that 20%, let me have them. And otherwise, if you get to that point or you have any questions, just always remember to call us, because that's the best way to handle these things. On the next page, we've talked about that 20%, because what cancer patients want to know is what's Medicare paying for. And again, Medicare pays 80% of your chemotherapy costs or your radiation costs. And that, what?
So long as it's IV.
Well, yes, that's what yes. If they do if it's intravenous. Now, and the injectable chemotherapy is covered under Part B, and radiation is covered under Part B. So that's the main part of Medicare that covers those treatments that you've been getting. Now, and again, you have to purchase that one of those extra kinds of insurances we talked about on the previous page, or you'll be paying all that 20% forever. And one of the key things to remember is, I mentioned Medigap plans pay most of the cost, and they do. But if you get a Medicare Advantage plan or a Rocky plan, the good thing about those is they all put a maximum out of pocket in for the year. So even if you have to pay quite a bit out as you're starting into therapy in a year, they have from $4,700 to about $6,700 max out of pocket. And I'm not diminishing the impact on that. That's a lot of money, but at least there's a cap. If you have one of those, if you reach that, you're out of pocket then for the rest of the year, your insurance will pay everything. So it's important to have some kind of supplemental coverage, or else that 20% goes on forever. If you just have A and B with no supplement, there's no stopgap. You pay forever. Now, oral chemo, yes, this is a huge issue for people, one that we don't understand as fully, because if someone comes in with a specific question, then we can research it. But there are so many different oral chemo drugs, some are covered, some aren't. But the key thing about the oral chemotherapy is to know that usually that is covered by your Part D, your drug coverage, which you need to purchase also, in addition to a supplement to help pay the health side. So on your drug plan, many oral chemo drugs are covered in there. It just depends on the ones you're taking. The way they explain it is, if you take it by mouth and the same drug is available in an injectable form as a prodrug, then they cover it. What that means, we've learned, is if the drug is an injectable drug and there's also an oral of the same drug, then they tend to pay for the oral drug. If there's not an injectable and it's only an oral, then they don't pay. And believe me, I've learned on Medicare a long time ago, don't ask why, because you'll lose too many brain cells over it. It's just the way some things are. So but the good thing is, on these Part Ds, we have a program where we can put in the drugs you take, and we can see which drug plan might cover the drug you take. Now, the bad thing is you only can change your drug plan during open enrollment, which is October 15th to December 7th. Each year, and it's effective on January 1st of the next year. And you always should come in, whether you have cancer or not, and have us look at your drug plans, because the drugs you take change, The drug plans change how they pay for drugs from year to year, and new plans come out. So don't assume just because one plan's been great that that's the best plan for you next year. It may not be, because believe me, they change a lot. They take drugs totally off formulary, and they tell you in a book about that thick. And do you read through that? No, most people don't. And so come January 1st, you get a really bad surprise when you go pay, you want the drug you got last year and they say now it's not available. Not a very good surprise. So please let us help you with that. So if right now you're taking oral chemo drugs and you want to know if they're covered, we can look in the program and try and find out, in the database to see if they're covered with the drug insurance you have today. The issue is if it's not and there's a better one, we can't change you right now. You can't change right now. The only exception to that is people who are low income and get a subsidy to pay for their premium for Part D can change their drug plan at any time. So if you have friends or acquaintances who are on getting help with their Medicare payments or on Medicaid, Medicare, they can change their plans.
Medicaid will pay for it, period.
Yeah, Medicaid pays. But yes, you have certain, obviously, income requirements to qualify for that one. Yeah. Okay, so what questions on what I just talked about? Our phone number is in there. Please, the last page, call us anytime. And the way we work is you leave a message and one of us will call you back. There are 7 of us. We're volunteers, so we're not sitting in there. We do have, just waiting for the phone to ring. We come in and we take the messages and call people back. And we would be very happy to help you. We don't know all the answers, I can tell you that, but we know how to research, and we have backdoor numbers into Medicare and places we can call to try and get extra help for ourselves when we don't know the answers.
Do you guys have certain days and certain hours that you work?
Well, we're all in there certain days, but it's the only time that you can know someone's going to be there are Thursdays. We do have walk-in days at 9 o'clock from about till 2. Yeah, on Thursday. Other than that, you just call, leave a message, and then we usually have someone, at least one person in the office every day, at least for some period of time.
Well, what I was thinking is if I was to call and I gave you the days that I was off, then you could work around it.
Absolutely. Somebody will call you and work out an appointment time. You bet. And if I call you and I work on Wednesdays and you can't come in, then I'll talk to somebody else that'll be there on Friday when you can come in. So yes, we would get that worked out. Okay, what questions on what we've covered so far? Okay, John's going to talk to you a little bit about some levels of income and where there might be some help in paying for premiums.
Thanks, Jean. Our mission as SHIP counselors is to give free service, unbiased service, and personalized service. So free, we don't charge anything at all. We're all volunteers. Unbiased, none of the 7 of us came from the insurance industry, but we all had an interest in it for some reason, or a fear of it for some reason, or a lack of understanding of it for some reason. And then also personalized, and we really do emphasize that we have 7 counselors. We're there every day of the week for some of that time. We are volunteers, so our hours are a little bit less dependable than if we were getting a paycheck. But typically we'll have a counselor there between 9 and 4 every day of the week to answer phones, set up appointments, things like that. Jean was talking mostly about how to get into Medicare. We have a free seminar called Medicare 101, and I'll leave copies of this. It's taught the first Wednesday of every month. It's a 2-hour seminar, and it goes into the parts of Medicare in more detail and how to put the pieces all together in a way that benefits you the best. My focus of my short talk today is once you're into Medicare, what can you do to control some of the costs of the program? Because medical costs, as you all know, are very expensive, and there are many ways that Medicare and related programs can help provide lower cost to you as you're going through your medical journey. And I'm going to talk through this from this chart called Financial Assistance Opportunities, and I think that Molly's also going to talk about ways to save some money on it, so there may be a little bit of overlap. But in addition to teaching a course about how to get into Medicare, we also have a course for those of us who have already been in Medicare for a while, and what changes are happening to Medicare, or what changes you might be able to make in your program to optimize your health care and your health insurance, And I'll leave these here as well. That class is taught every other month on the second Wednesday of the month, and again, it's free. We try to keep that class small because we get into a lot of political discussions about changes in Medicare, but it's a fun class talking about how Medicare is going to change and how you can change your plans. Let's talk about some ways where you might be able to control some of the costs of medical care and of the medications you're taking. These are some of the most common programs, and it's just touching the surface of the programs available, and Molly will talk about some others. But the first one on the top is particularly attractive to those that are on Medicare because of disability, under 65. And if they're on Medicare because of disability, there's a likelihood that they can qualify for Medicaid buy-in. The advantage of Medicaid buy-in is that the premiums of this program are very low, typically $25 to $90 a month, and the spectrum of coverage is much greater than Medicare. It also covers vision, it also covers dental, it also covers hearing, and so the Medicaid buy-in program is very valuable to those that are on Medicare and less than 65 because they're disabled. The second box is something called RX Outreach. It's an online program. I see it's on Molly's list as well. It's a way that you might be able to save on your medications. Most people think they can only get their medications through their drug plan in Medicare, but there's really many ways they can get it. They can get it through their drug plan. The pharmacies set up their own costs. There's another program called Good RX, and we have cards for this. You don't have to be on Medicare to do this, but this program also negotiates its own costs with pharmacies. Canada has its own pharmacy programs. So there are a number of ways to control your medication costs. And if the medication costs to you are egregious, burdensome, do come to talk to us and we'll offer some of these other opportunities to you, and you might find another way to reduce your medication costs. The third line is called Colorado Indigent Care Program. It's a program that discounts care at the facilities that are involved in it. Typically they're hospitals, but it'll reduce the costs at St. Mary's or at community if you fall within these income guidelines. The next line is called Low Income Subsidy. It's a program run by the federal government, and it can reduce your medication costs. It does have income and asset limits. Income limits about $1,500 a month for an individual, about $2,000 a month for a couple, and then it has an asset limit of $14,000 and $27,000. But that does not include a car, it does not include your vehicle, it does not include the contents of your vehicle or the contents of your house. And then we go down to Medicare Savings Program, which helps with your Part B premiums and maybe some of your medical costs. And then at the bottom is Medicaid. Many people don't recognize that you can have Medicare and Medicaid at the same time if you fall within certain guidelines. I'm not going to go into any more detail on these, but this is just touching the surface, maybe to pique your interest. If you feel like your medical costs are out of control, then do come to talk to us, because in the past we found that about 75% of the people that come to talk to us can find something available to them to reduce either their medical costs or their drug costs. Molly?
John, can I ask a quick
Sure,
question?
sure.
The income limits on the left column,
Right.
I assume those include Social Security income, Social Security disability, all those.
They include all sorts of income, but the different governments count those incomes in different ways. Sometimes they'll take a certain amount off that income against it, an offset. Sometimes they'll only count it half. Some of the programs only count a half of earned income. And so if you're anywhere within, near that range, do come talk to us. We've had people that actually have incomes over that range that do qualify for some reason we don't understand. We don't qualify the people, we just introduce you to the programs and provide the applications so that you can deal with the agencies that do handle those programs. That's a great question though.
So with SSI, is it COBRA that you have to have the in-between before you would qualify for Medicare? Or is it a supplement you?
Well, COBRA is usually where you.
Usually for workers, people leaving work.
And
If you go on
that's a
SSDI,
bridge kind of
if you
insurance.
go on disability insurance, there's a 2-year gap before you qualify for Medicare.
Right.
In that 2-year gap, you may qualify for Medicaid buy-in. You may qualify for the Affordable Care Act, or some people may call it less than Affordable Care Act. But there are also offset programs for those also that might help reduce your costs. But it takes 2 years to get on Medicare once you qualify for SSI or SSDI.
Is anybody in here on the Rocky Mountain supplemental plans for Medicare? Okay.
Premiums are low, but there are a lot of copays. And so for those people that have a lot of medical costs, sometimes it's better to go with a Medigap plan than a Rocky Mountain plan.
And just one comment, if you know anybody new approaching Medicare age and they have an illness such as cancer or a heart or issue, make sure they understand and come to us, so we'll help them understand. But when you're first new on Medicare, you can buy these Medigap plans, which cost more but cover a lot more, without them looking at your health. But once you're on Medicare and you say you did Rocky Mountain for a year and then you decide, I'm tired of these copays, I want a Medigap, you can apply, but they can look at they will look at your health, and they can turn you down or charge you higher premiums. So at the time someone is going on Medicare for the first time, and if you have a known medical issue, you need to think long and hard about those Medigap plans and getting one, because that's your time you can get it without them looking at your health. It's really important time.
So, because I carry our insurance through St. Mary's, and when I quit, my husband is Medicare, he has been for years. Will they look at his health?
No, because he's been on a qualified plan through your work with more than 20 employees, when you're getting ready to stop working, say it's next July 1st, he has that guarantee issue because he's had insurance, so he is fine. He will have that. But again, don't miss that window because he won't get it again. No, and you can work till I'm just helping somebody now who's 79 years old, he's working at Albertsons. Well, guess what's happening? He's not gonna have a job. Well, he's had, all for 79 years, he's had their insurance, and he is absolutely fine, no penalties. He goes on Medicare because he had their insurance. Yeah. What I want to tell you about on this Rocky is if you know anybody on it, they have 4 plans. What isn't publicized is on these Rocky plans, you can switch between them each month. And if one doesn't pay, if this one up here is a lot more expensive, but it pays a whole lot better, and you're having surgery next month, you can switch to a different Rocky Mountain plan, and it's effective the first of the next month.
They didn't tell us that.
No, they don't tell you that. They know we tell you though, and they can't do anything about it.
What's their status though with United Healthcare? And
They are, at least did they say through 20?
They have an agreement with United Healthcare to not change anything substantial until 2020.
oh, okay.
And 2020 is an interesting year because that's the year that's in the Paul Ryan bills.
For changing Medicare.
For changing Medicare. So I think that Rocky and United Healthcare are anticipating a lot of changes in 2020. But they are now have an agreement that nothing changes for the next 2.5 to 3 years.
Yeah. Okay. Molly.
Thanks. Hi. So, I'm going to talk to you a little bit about somewhat John touched on about paying for prescriptions and stuff, but also about paying for cancer treatment in general, because we know it's like crazy expensive. So in your bag you have a handout like this, and on it is a list of resources that cover different types of cancer. But there's the big ones: RX Outreach, RX Assist, RX Hope, and Needy Meds is also on there. So those are ones that can help, like Jean and John were saying, with the oral chemo meds, because if it's not injectable, we know, one med can run you $3,000 a month or better. So with those programs, those are gonna help cut your cost, or help with that 20% if you don't have the Medigap plan, or if you do and the insurance still doesn't cover it all, you can look at these programs. The other thing is I have a list in my office that is like this thick and it's every financial program I could find, whether you need help with transportation for your cancer care, if you need lodging for cancer care, if you need childcare for cancer care. I mean, it talks about different ways to get funding sources, and they duplicate some of themselves. But and I can't recommend one or another. It's a list that was put together, half of it, and then I gathered a list from somewhere else, and we kind of compiled it all. So if you would like that list, and the reason I didn't bring it today was because it's like that thick, and it's very overwhelming. So but if you would like that list, feel free to email me, and I will be happy to give you all those resources.
Okay, question. When you say cancer care, is it only when the cancer is active, or are you also talking about going into survivorship also?
So some of them do, a lot of them do mostly when it's active. So you're gonna find on here and in the packet I speak of, co-pay assistance. You know, when you have to go to the hospital or the doctor and you're paying that 20%, you know, so there's co-pay assistance, there's medication assistance, and so there's some groups though for survivorship. Like I know the Ahern group for women, they help low-income families or low-income women get mammograms. And so there is stuff like that on there for survivorship. So if you're not familiar with the survivorship program at St. Mary's, we also have amazing resources in your bag. There's should be a calendar, and you'll find this book. And it also has some different resources in there for you as well. That the groups we do are free, the support groups. And you have access to me all you want. And if I can't find the answer, I'll find someone who knows. Go ahead.
Can I ask a couple questions?
Sure, go ahead.
For the list that you mentioned of resources,
Mhm.
does that include information like the funds available through the survivorship program or the Montfort Family Foundation at CU to help people travel for care, gas cards, hotel, food, meal cards, that type of thing? Is that included in your list?
There's some of those on the list, but the list I have is primarily made up of the place, the foundation or whatever, the email address and the phone number. So, does that answer your question?
It does, but you know, like you would probably have Montfort Family Foundation or St. Mary's Survivorship Foundation,
Yes.
people could contact them.
Yes.
Which just kind of brings me to a comment. You just said, you know, you asked if people are familiar with St. Mary's Survivorship Program. If you're not, get familiar with them.
Yes.
Because the survivorship program is a phenomenal resource for that financial resource as well as everything that's in that booklet that's in your bag.
We often will do, we're very blessed through donations from the community and other resources that we are very blessed to be able to help patients with gift cards for
Right.
like the drive back from Montrose back and forth for treatment. You know, we try to put a cap on it per se, per family per year, but there's extenuating circumstances or two, but a lot of times I will give out gift cards for gas, for food. We have the Rose Hill Hospitality House. So when you're coming for treatment, or your loved one is coming for treatment and you're driving from out of town, you can get on the list to stay at Rose Hill, and you can pay $5 a day to stay there, or you can pay nothing. They're very nice rooms. It's like a hotel room. When my mom has extensive stage small cell lung cancer that she's battling currently. And I know when we first started coming from Craig, she utilized Rose Hill Hospitality House. And so it's a very nice place to stay. So that's another resource. as well. So, you know, when we're talking about paying for your cancer care, that, you know, that is not out of pocket, that you have to have that expense. And to stay there, you just need a referral from me.
But you also have to be aware that if it's a teenager, they have to have an adult with them.
Yes, you have to have an adult. If it's a teenager, she's exactly right. So, you know, and it's really not for like a big family group, it's like for the patient and possibly a caregiver, or the spouse and a caregiver, so.
And I know for us, generally they will they used to, I don't know if they're still doing it, they used to make you leave about a day every 2 weeks so they can clean the rooms.
Yes, and so what we have a lot of cancer patients that do is they'll come in on Monday and start treatment, and then they'll go home on Friday for the weekend, and then they'll come back again. On the weekend, we tend to, that's when we see a lot of like trauma, and then, so first is NICU patients, babies, trauma patients, and then they try to give priority to our cancer patients, oncology, radiation patients too. So, but there are a limited number of beds. Go ahead.
Well, and I've heard stories from doctors, staff, hospital staff, survivorship people and whatnot, that, people from, Paonia, Vernal, wherever the outlying areas in our service area, that there's a whole lot of resistance if their doc refers them to St. Mary's or to Grand Junction for care because of the affordability, just traveling, just filling the tank with gas, or getting a place to stay, or, food, and those resources are available, as you're saying.
Yes.
But in addition, the same kind of resources are available for people who may have to go to Denver for, to see a specialist, get a second opinion, have treatment there. Brian Davidson mentioned earlier today affiliations between St. Mary's and the other SCL hospitals in Denver and the University of Colorado. Well, there are resources, I'm just saying, as people know of people who might be in need, to help them get over there, because it's just a concept of having to go across the mountain, over to Denver, can be overwhelming if you're sick, but particularly if there's no if you need financial support,
And
it's there.
And a lot of times what I'll do is I'll contact a social worker at one of our sister hospitals and say, hey, I have this family that's coming, or I can put them in touch with a social worker at Colorado, University of Colorado, to know this family's coming. And between myself and the other social worker or case managers, we're able to start working on helping them get some financing and qualifying for disability, sending them to the financial counselor for Medicaid to see if they're available for those kind of things. And so in the packet that I'm talking about too, there are things like Joe's House, where they help pay for hotel rooms, and we have volunteers that will sometimes transport you to Denver or places for your appointments. Sunshine Taxi takes Medicaid, and so does I'm not sure if K2 does, but Sunshine Taxi takes Medicaid. And if you qualify, you call and you give them your Medicaid information, your taxi ride is free.
Oh, wow.
So that's another resource when we're talking about paying for your cancer treatment. We have, we're very fortunate to have a young gal with us named Marisol. She's in the pharmacy, and what Marisol does is she takes your prescription for your cancer drug, for oral meds, and she helps you apply to these different companies to get you no cost or low cost access to your prescriptions for oral chemo. So if you're going to a hospital in Denver, you should also look for those kinds of people in the pharmacy that can help you apply for prescription assistance. The thing with paying for cancer care too is you're going to have to do some legwork, like with Medicare, because financing is so limited and stuff. They're going to want you to fill out applications and jump through hoops and things like that. But I can help with those. I'm always happy to help. We have volunteers that can help fill out the forms. I can fax them for you, you know, things like that. And so I spend a great deal of time with patients just trying to accomplish some of these things, as far as applications and getting them sent and helping them find funding. So I like to, on here too, if you go to healthcare.gov, it talks about seeing if you're eligible for Medicaid, but it's really just doing like a lot of research and going to these different sites, and you know, it's takes some legwork, and so I'll help the patients and I do some of that for them, but they have to do some of that themselves as well. You know, go and looking for websites and things like that. And so, like John was saying too, with the RX meds and the needy meds, and those are good places to start when looking at paying for your prescriptions. So.
Can I ask another busybody question? Programs like RX Outreach or any of those on the list, and this question, all three of you, do you get people who are looking for assistance when they reach the donut hole in their medication coverage? You pay a certain amount out of pocket and Medicare pays, then you get to a point where now you have to pay a lot more until you reach another level, and then you're in catastrophic care. But the exposure could be $2,000 to $3,000, as I recall, in the donut hole. Do you ever have people come in or do any of these programs kind of double up and pay for or provide assistance for people that are in the donut hole?
Oh, yeah, and sometimes it's good too to try those people before they get to the donut hole.
That's right.
We try and get them on the drug
Okay.
cheaper so they don't even get to the donut hole. Sometimes people will have 5 drugs they take and one's
Right.
brand name, so it's real expensive and the others aren't. Sometimes they'll say, I'm gonna go get that drug from Canada. We don't even put it in their drug list when we choose a plan for them, because they're
Oh.
getting that one out of Canada. And we get them a drug plan that covers their others. Or they might find that they can get it from Good RX cheaper, so they don't even put it in
Gotcha.
their prescription drug plan, because to get to this donut hole, they take the full cost of the drug, not
Right.
what you're paying, it's the
Right.
full cost. So if you don't put it into your insurance because you're buying it off another program, then you're not gonna get to the donut hole on your other cheaper drugs. So,
Okay.
yeah, we play those games all the time. Yeah,
Yeah.
good games.
Yeah.
So aggravating.
It's very, yeah, it is aggravating because
Oh, that's
it's,
crazy, but
it is. I mean, we see these patients struggling, and I mean, just like John and Jean do, I mean, struggling to pay for cancer treatment and to just get what they need. And, you know, at St. Mary's is fortunate enough that we do charity care as well. We have financial counselors to help walk you through those applications. And, you know, for people that just cannot pay, we're obviously not going to deny them their cancer treatments. And so that's why, you know, just accessing all the resources that you can find through the packets and on the internet. I know, and some of them will run out of money. The Leukemia Lymphoma Foundation is now out of money. And so they've shut down for a little bit to fundraise and regather up, and so they're not handing out co-pays. But I had a patient that was a little frustrated because the grant was only $500, and she said $500 is not gonna touch what I need, but if you get 3 and 4 grants for $500, I mean, that adds up quickly to help you pay for your care. Some prescription plans also will help you do like for a year's supply too. I know, you know, if that's like a maintenance chemo or something, that, for a maintenance chemo, then they can help you pay for those as well. So it's just all about getting online and accessing those. And like I said, I'm happy to email you that packet, if you would like. And it'll give you websites and phone numbers and things like that. So there are programs out there to help you with co-pays and prescriptions. It's just hunting them down.
And
So
what's your name again, and how do we get a hold of you?
My name is Molly,
Uh-huh.
and I'm at St. Mary's Regional Cancer Center. I'm the oncology social worker there. If we have patients that have been admitted to the hospital, I'll go see them as well. But I primarily am housed in the cancer center across the street from the hospital. And my email address is molly.mcdougal, McDougal, @sclhs.net.
SCLHS.
Yeah.
And if you wanna talk to her, just go to the receptionist. And she'll pop out of the office and say hi.
That's right.
Yes, I will pop out and say hi.
She's really good at that.
Thank you. I do that a lot. I like to.
It's encouraging.
Good, I'm glad. So yes, I will pop out and talk to you about whatever you want to talk about. So we talk about fishing and bow hunting and we talk about all kinds of stuff. So, but yeah, so that's really all I kind of have.
What other questions do you have for any of us?
Do you guys have any, Claire?
How hard is it to make changes with Medicare? I got A and B, but if I wanted to add on the Advantage,
You don't have any other coverage? Are you a veteran? Do you get coverage at the VA?
I could, I think.
Well, you can add the Rocky Mountain coverage at any time.
Yeah, that supplemental you can add, I believe, any.
The Medigap you can too, but if you have cancer, it's gonna be harder for them to approve it. But you can apply at any time.
So far, everything's going okay, and the costs aren't too bad.
The 20%'s not getting you, huh?
Hmm?
The 20% you're having to pay? Okay.
What I ended up doing when I retired, I got my Edward Jones account,
Yeah?
and I'll borrow from that if I need to.
Okay, well, yeah, but you could sign up for one of those Rocky Mountain plans at any time. Why don't you call us and come in and see us, and we can explain that to you.
Well, because
Yeah,
I don't like the changes that are coming.
yeah, we can explain. Well, we don't know what those changes are. So, when we know specifics, then we can talk about those. Right now, we can deal with what's here today, and we can sure help you know what your options are you can do today to help offset some of those costs, which is usually a good
Yeah,
idea.
definitely.
And
Yeah.
you need to deplete, that way you won't have to deplete that
Yeah,
option that
Right.
you have,
Right.
you know?
The Edward Jones could be used for fishing or.
yeah,
Crap.
that's right. Come on, get real.
Bow hunting,
Yeah.
fishing.
As long as, any other questions? What other questions? I just want to give you a little commercial on some other group that's very important to know, and I don't know whether Molly knows about this. Have any of you heard of Domus Pachus? They are a nonprofit out of Breckenridge, Colorado. And they arrange week-long respite stays for cancer patients and their families. Wealthy people donate their 5, 6, 7-bedroom houses and condos. They take care of you for a week. There is absolutely no cost. They provide you with food. They provide you with gift certificates to places. They take care of you like you're royalty. And it's a wonderful way to get your family together. You do not have to be dying. You just cancer patients. And I have a friend who has utilized it. I live up there in the summer, so I help them. They get together one day a month, and we prepare all this food, and they freeze it, and they give you this when you first come to have breakfast burritos and all this stuff. And then last October, I got to experience it firsthand with my sister. And you really should do this. It's a very, very special time to have. And it's absolutely free. Domus Pachus.
How do you spell that?
D-O-M-U-S? Pachus, P-A-C-I-S?
I-A-S or I-S?
I-S, I think, Domus Pachus. It's something, safe home or something.
They have brochures in my office.
It is a wonderful,
So-
and for people all over the country, you can go and experience this. And it is just a wonderful thing to do with your family and celebrate all your time together. So do it. It's really great.
Yeah, no, I agree.
Okay, any other thing on?
And I think they're on that list I was
They
talking
could
about.
be, I know that Doug, who runs it, is coming over sometime, and we can talk to everybody and promote it.
Oh, good.
Yeah.
Does your organization have brochures that we can put at different places to give to our patients as an option, you know?
Sure, for us, you could see Deborah Hess and
Okay.
she's the one that's heading this
Yes,
conference. And she can give you brochures on our survivorship
thank you.
programs. There you go.
There you go.
Need a few more?
I have several people that.
Put it, yeah, just doctor's offices, wherever, yeah, because people should call us with Medicare questions.
John and Jean are amazing. So
There are 5 more of us that are just as amazing.
More.
RSVP.
But,
Just in
Yeah,
Grand
so-
Junction, there are 7 of us.
and I have tons of brochures. I have brochures on, you know, home health options and, you know, resources through RSVP, transportation resources through the American Cancer Society.
Is this a national, program, or is
SHIP
this for
is.
the state?
SHIP
SHIP
is.
is national.
And there's a 800 number on the back of that, isn't there? I think, look on the back of the brochure, is there an 800 number?
Not that I see.
No, but there's 1,300 ships around the
Yeah.
country,
Okay,
with 12,000 volunteers.
And if you Google the SHIP, you'll find an 800 number, and if you call that, it looks at your phone number and sends you to the proper SHIP office geographically.
Gee, there's an 800, there's no 800 number.
Yeah, it's just our local.
gotta fix that.
Yep,
Yeah.
we
Better
learn something
ship,
every
ship.
time, we learn something every time here.
And what does SHIP stand for?
Senior Health Insurance Program. And we're-
Assistance program, but they had trouble saying SHIP, so.
Insurance Assistance Program. Yeah, we're regulated by DORA, the Department of Regulatory Affairs, under the Insurance Commissioner, and it's a federal program, and they manage our training and our certification, and they bond us in case we screw up.
So Molly, what do you do for people like me? I don't belong to St. Mary's, I belong to university. I'm still working, that's why I had all those questions.
Yes.
But I need to quit pretty soon. Will you still be somebody that I can go to since I don't belong to St. Mary's? Cause I know when I was diagnosed 3 years ago, it was kind of like, oh, you kinda felt like you were hanging out there in the wind with nobody.
I'll be there for you for as long as I'm a senior. So, my door is always open, whether you received your cancer treatment somewhere else, but I'll work with any cancer patient. And I'm pretty sure that's how our survivor program works too. Any cancer patient, whether it was from us or somewhere else, so.
That's a great program.
Yeah.
And that Rose Hill House. Have you all heard of the Rose Hill Rally Bike Event, May 7th? I'm on that committee too. So, but we raise usually $20,000 to $25,000 for the house. It's just a wonderful
The
20-room
road,
hotel.
and it
Really
is,
lovely.
it's beautiful. I mean, like I said, my mom stayed there for cancer treatment. My dad, when he had a stroke, we were there 20-some days, when he had a heart attack. So we're very familiar, even before I worked for St. Mary's with Rose Hill. You know, you bring your food in and
Yeah,
you
they've got
can
a kitchen.
store it, they have a kitchen.
And it's not just food and lodging, it's emotional
It's
support. They have a
emotional support.
volunteer there who will help you know resources you need in town and where there's a laundromat or where there's a restaurant. I mean, they really have a lot of support
Yeah.
for you emotionally as well.
Yeah. So yeah, I'm, you know, I don't ever turn anyone away.
The other thing I was gonna ask you, and I don't know if you can do this or not, but when I did the clinical trial the first go round, they reimbursed us our travel, I mean, very well as far as that went, but they can't automatically tell you that. Do you guys, how do you hint to your people when they're in a clinical trial that they can be reimbursed? Because you have to ask first, they can't tell you, because it's considered coercion.
Oh.
Right, and so most clinical trials will reimburse you.
Right, but
Or-
how do you tell the patient that they have to ask to be reimbursed?
Just like that. I just say make sure that you ask about reimbursement, so. And I think, as far as I know, I think our research team, the girls next door that are in charge of clinical trials, I think they tell them too. So, I've learned a lot by trial and error going through this with my mom.
Yeah,
So,
exactly.
I've found some things that no one tells you, And that I try to relay to patients because, like you said, if you don't ask, you don't know. So, so I'll tell patients, you know, if you're doing a trial, make sure you ask if they reimburse you. Or do you get, you know, are they paying for your lodging, or are they, you know, how often do you have to go? And so I always encourage people to ask those kind of questions, because it is expensive. I mean, even if you're going once a week or once every 2 weeks, I mean, like we're saying, Denver's just over the hill. You know, it's only a 3.5 hour drive or whatever, but, you know, by the time you're wear and tear on your body and you pay for fuel.
Not an easy hill.
And, yeah, no, it's not. And so, yeah,
And well, it's not just over the hill, you have to go the night before.
Yep.
Yep.
Because you have to have the CT scan so that they can have, and the lab work, so they can have it for you the next day.
right. And so, you know, that's,
And weather always plays into that too, yeah.
And we had to go every week for 6 weeks, and then we went every 2 weeks for 3 months, and then we went monthly until I got sick. So, yeah.
yeah,
Yeah.
it's a long journey. It's a long road, it's a long experience, and so, yeah. And so, you know, whatever resources that I can help you find to help pay for some of that, I'm happy to do.
Some of my friends asked me, how come I didn't go to Denver for cancer treatment? I said, because my doctor worked at primary care and he directed everything over to here and over to St. Mary's. And it's like, can't go wrong with St. Mary's.
Which was true, but at the time, for me at the time, the oncologist that they put me up against, I didn't like him. And I wouldn't go back. And Virgilio had already left, and she wasn't seeing any new patients. So I chose to go to Denver instead.
The nice thing is now and I've only been at St. Mary's about 3 months. The nice thing now is we have a variety of oncologists, and the good thing is I feel like that when maybe one isn't working for a patient, you can choose another one if they have openings. And a lot of our oncologists, they specialize in a little bit different things, like they're all oncologists, so they are very good at collaborating together to make sure that you're getting the best treatment you can. Or they do send you to Denver, or I know community uses Huntsman for trials, and we use Denver mostly, but I mean, if you wanna do a clinical trial, you can talk to the doctor and research can see if there's any available for you. But they're costly, they're time consuming, and so, yeah. Does anybody have any more questions about paying for your?
Thanks for coming.
Thank you.
Thank you.
I hope we answered